Hello, and thank you for inviting me to speak today. I'm Karen Ousey. I'm Professor of Skin Integrity at the University of Huddersfield in the United Kingdom. And today I'm going to be doing an overview of really my journey in wound care, but I've decided to entitle it Making a Difference, Improving Patient Outcomes. So I have no conflicts to declare. And hopefully by the end of this session, you'll understand the changing role of nursing has got a bit of a UK focus on it, but I do feel that's transferable globally, and be aware of a personal journey, which is mine throughout the wound care world. So just briefly looking at the nursing of history, the history of nursing, sorry. Historically, nurses have been female, as we know. We're seeing more and more males coming into the profession, which is excellent. But in the past, it's been very much seen as the handmaiden of the doctor, and nurses have been carrying out orders from the doctors. In the 1800s, nursing represented the caring and nurturing role of women in the family, society, and church. So it very much was all-encompassing at that point, but wasn't particularly seen as an academic career. Florence Nightingale, who we all know, she highlighted the environment of healthcare, but she also highlighted the important role that nurses play from a social and economic, a physical, and the mental health well-being of all our patients. And the International Council for Nurses, many years later, said that nurses must be involved in research. And that really was a pivotal point for everybody, because it was only at that point that the world began to realise that nursing could actually make a real difference, and that the interventions that we developed and delivered were actually based on the best available evidence and research. And through this, we've seen nursing continue to grow and nurture, and we've seen the development of specialist and consultant nurse roles as well. However, throughout this transition, I think sometimes we've seen somewhat of an imposter syndrome. And from a very personal way, I've often felt as an imposter that I'm a nurse. How can people actually listen to what I'm saying? And is my research important? Well, yes, it is important, and never more so when we look at an image such as this and we think, well, where is the nurse here? And actually, where is the patient here as well? You can see that these are the middle class medical staff looking at a patient and literally looking at the patient, not listening to the patient, not paying any attention to who is the person in the bed, but rather using that person as a teaching tool. And I particularly like the stethoscopes here, which are all joined together, and the poor patient is looking stunned. But where's the nurse there? Be it a male nurse or a female nurse, they should be there standing up for the rights of the patient. And this is very much why I came into nursing, to be caring and to also help those patients. And we've seen this changing role of women within nursing as well, from Florence Nightingale, then of course here as the handmaiden to the doctor. And then generally we've seen that role change, and much of it's changed from nurses being seen as the handmaiden to nurses being seen as a real asset to the healthcare team. And a lot of this has gone through the uniforms as well. So we've seen nurses change from that very starch uniform to being a very much theatre scrubs or just general civvies. And nursing within wound care has been massive. It is very much a nurse-led speciality, especially in the UK. And nurses here have done much research that's helped improve outcomes for patients. And it was when I was first as a staff nurse on an orthopaedic ward, I looked at our patients and thought, why do all these patients have what we call bed sores then, and infected wounds? And it was out of that interest of trying to work out, well, these patients really shouldn't be getting pressure ulcers or pressure injuries. There must be something we can do. But when we looked at management of wounds as well, we saw a range of different things being taken as being good things to use for the wounds, such as Ousey, which was the Edinburgh University solution of lime. Well, who would want to put lime into a wound these days? We also have mercurochrome, and we used to put this onto patients' bed sores or pressure ulcers, and it used to sting. We also use egg whites and oxygen to try and manage pressure ulcers. And strangely, these did work, but that was probably because we actually had to move the patient off the bottom and relieve the pressure, rather than the fact we were going in the kitchen and getting eggs and putting oxygen there. And of course, there's also hydrogen peroxide and perflavin that we used a lot. But as a newly registered nurse, I never believed that I would eventually become a professor. And here for you is a picture of my good self. And there I am in the middle. So have changed a little bit. So since going through this huge journey of being a student nurse, then a staff nurse and a ward sister, I've developed a huge interest of understanding patients' quality of life and understanding research as well. And through this, it's culminated into the development of the Institute for Skin Integrity Infection Prevention. And this institute is based at the University of Huddersfield, and I'm the director. It is unique because it is a collaboration of a range of different professionals working together in the field of skin and infection prevention with a joint ethos to improve quality of care for patients and their carers. And our aim is this bench to bedside ethos to improve and benefit clinical practice areas and improve quality of life for patients and their carers. It's interdisciplinary and it's international. And we have colleagues from engineering, computing, pharmacy, biology, microbiology, nursing, occupational therapy, podiatry, and all the allied professions to medicine, as well as art, design, and architecture. And you may be thinking, well, how do these all link together? Well, our engineers are able to see how much damage can be caused to skin because of friction and shear. Pharmacists obviously can see about antimicrobial resistance and which antibiotics should and should not be used. But they also have expertise in how we get things through the skin as well. And of course, healthcare professionals can ensure that all the research that we do actually has a direct impact onto clinical outcomes. So it combines academics, practitioners, international experts, and of course, social service users. And it's important that we have an international aspect to this as well, because everybody in the world has skin. We all have the same issues with skin, and we should always be aiming to strive to improve outcomes for patients. So within the Institute, I'm delighted to be the director and also to have brought together all that learning in clinical practice to be able to share on a global stage. And we do lots of research. We also do evaluations. And importantly, we offer lots of education. So master's education, but conferences at least once a year, which are free to attend on a global level. So we hold them virtually, so anybody can come and listen, and we record them all. And that's to share our expertise and to share ideas. We also support our industry colleagues, because without industry, we wouldn't have new products, and neither will we have innovations. And it's important that we all get together to share our experiences and expertise. So from being a very young nurse, who hopefully was unrecognisable in that picture, you can see that as you go through your career, you must believe in yourself. And it's important that you develop an interest in a specific area. And obviously, I developed an interest in skin and infection prevention. Always keep studying, if it's just reading different journals or books, and immerse yourself in research. Find out why we're doing what we do and question everything that's happening. But learn to be a good communicator and a good listener, and particularly listening to patients and their carers, but also listen to other professionals to find out where the barriers and the boundaries are to improving quality of care, but also to improving yourself. And it's important that we work collaboratively and work interprofessionally. We're not an island. When we're out in clinical practice, it's essential that we work together and understanding each other's interests. And the biggest thing that I can say to you is always believe in yourself, because that's the secret to success. You can be what you want to be. So from a young northern girl, I am now Professor of Skin Integrity. And if I can do it, anybody can do it. And all we want to do is improve outcomes for patients. Thank you very much for listening. Okay, Ahmed.